If you're missing a tooth, a single dental implant can fill the gap and restore both the beauty and function of a healthy smile. Learn about the implant process to find out if it may be right for you. What's the side effect of missing a tooth? A missing tooth in an easily noticeable position can not only affect a person's confidence, but it can also potentially cause oral health problems, including tooth shifting, grinding, clenching, and a jaw pain or bone loss. A missing tooth also creates spaces around teeth that are difficult to clean, increasing the risk of plaque and bacteria. All these problems can ultimately require additional dental care, meaning more headaches and more money. How a single tooth implant works. A single tooth dental implant replaces a tooth lost due to decay, disease, injuries, or congenital conditions. It consists of a metal post that forms an artificial tooth root, the implant, an abutment inserted onto the post, and a replacement tooth made of ceramic, metal, or porcelain fused to metal. A single dental implant is a superior solution for replacing a missing tooth as it does not affect the surrounding teeth, unlike the alternative, which is a fixed tooth supported bridge. While a supported bridge is appropriate for some patients, it necessitates a more complex treatment of the surrounding teeth, using these teeth as anchors for the false replacement tooth. Discover the benefits of a single tooth implant. According to the American College of Prosthodontists, an estimated 178 million Americans are missing at least one tooth. But you don't have to be one of them. There are numerous advantages of getting a single tooth implant to replace a lost tooth. Natural appearance. Replacement teeth look, feel, and function like natural teeth, so there's no need to worry about your restoration being obvious when you smile. A stable foundation. The metal implants hold the replacement tooth in place, preventing it from shifting or falling out, so you can eat all your favorite foods with confidence. It's a permanent solution. Dental implants are designed to be a permanent solution for replacing a missing tooth, and they rarely have complications. They also promote bone health. The titanium post, which acts as an artificial tooth root, fuses with the jaw, stimulating bone growth to support and maintain the facial structure. It's less invasive. This process is less invasive than other options because there's no need to alter the structure of surrounding teeth. A single implant is more straightforward to insert. So what is the implant process? A single dental implant is a multi-step process that occurs over a few months. Implantation is the first step. During your initial appointment, your dentist makes a small incision in the gum to expose the bone. They drill a hole in the bone and insert the titanium post. The gums are then stitched closed and a temporary tooth is placed. Over several weeks to months, the titanium post fuses with your jaw to create a stable foundation for permanent restoration. When fully healed, you'll return for another visit where your replacement tooth will be attached. Dental implants are performed under local anesthetic, so you won't feel any discomfort. Thrive Dental also offers sedation dentistry if you're anxious about the procedure or don't respond well to local anesthetic. We strive to ensure our patients feel comfortable and pain-free during routine dental visits and oral surgery. Single dental implant recovery. A single implant placement typically causes less discomfort than tooth extractions or multiple implant surgery. However, you may have minor soreness, bruising, swelling, or bleeding at the implant site for a few days to a week or more following the procedure. Over-the-counter pain relievers are generally effective for reducing any discomfort. We typically advise patients to stick to soft foods and avoid certain activities after surgery. Following your dentist's aftercare instructions promotes a smooth recovery without complications. So, am I a candidate for a single tooth implant? While many patients benefit from a single tooth implant, a comprehensive oral examination and x-rays are necessary to determine if it's the ideal solution for you. Our experienced dentists consider several factors before recommending single dental implants, which include the gum health, jawbone health and density, health and position of the remaining teeth, oral hygiene habits, and overall health. You're a good candidate for the procedure if you have healthy gums and adequate healthy bone to support a dental implant. If you decide to have the implant surgery, your dentist will create and review your personalized treatment plan so you know what to expect and how to prepare. We are here to answer your questions and address any concerns every step of the way. Remember, modern tooth implants are more durable, comfortable, and natural than ever. So call, message, or book an appointment online to start your smile transformation journey today.